To restore your bad or missing teeth, or if you have pain and infection, a lot of times there's those billboards you see or advertisements. It's teeth in a day or something like that. It can be a little bit misleading because you don't just show up one day, we do it all. There's a ton of background work. There's a lot of planning, there's a lot of training, there's a lot of specific treatment planning that goes on for your individual mouth. There's different options. It depends on what you want to do. The best option is making an appointment with one of us doctors. We'll sit down and look at your 3D x-rays. We'll look in your mouth. We'll see your specific concerns and what's causing you to be in the dental office in the first place. Make sure we address all those concerns and make a good game plan with you. If that game plan, it can consist of either taking out all or most of your teeth and getting full dental implants. Either way, we make a plan so that you can chew, that you can smile confidently, look good, and feel great about your smile. Technology is crazy these days. I mean, we have 3D x-rays that can look at all your nerves, every little part of your bone to see exactly where we want to put implants and a treatment plan. You literally do the surgery before we even touch you. And so we can use 3D x-ray, we can have digital scanners to scan the teeth, exactly what position they are, and make a game plan of where we want to put the implants, what angle, what depth, what size, so that it's a streamlined process throughout the whole thing. Every person is different, every mouth is different, so it depends on what your specific needs are. We can treat whether you need implants or you need crowns or restorative work. We have different tools here at the office. At Whiteridge, we have specific lasers to treat failing implants, or if teeth have infection around it, to regrow some of that bone and regenerate the healthy gums back. Another tool that's super helpful with surgery, we have what's called a PRF machine. So we draw blood whenever we do surgery. We spin your blood around, which separates your blood and then your plasma. We get the membrane and we can place it over the bone graft or wherever we did surgery. So your recovery time is improved and then your pain is reduced. So depending on your specific situation, whether it be one implant or full mouth rehab, we can do all that here. To learn more about dental implants, I would encourage you to come in physically to the office. When you come into the office, we'll take an x-ray of you and review it together. So we'll sit down in the consult room. Any questions that you have, we can review your concerns and make up a good treatment plan for you. Feel free to reach out to me or Dr. Hepworth. Our team here at Whiteridge will take care of you.